So I think that Shea, I want to be kind of cognizant of your time and everybody else's time on here. So I'm going to turn it over to you.
Beautiful. Thank you. Well, Justin, thanks for giving me the opportunity. I'm always happy to share kind of some of our new data and the things that we have going on here at the Coleman Institute for Cognitive Disabilities at the University of Colorado. I am the acting executive director here at the Coleman Institute. I'm also an assistant professor out of the Department of Psychiatry at Anschutz Medical Campus at the University of Colorado. So some of this falls into some of my research as well as the Coleman Institute side. We generally have two sides of our hats here at the Coleman Institute. We have our faculty roles as well as our kind of advancing technology supports and catalyzing those supports for folks with cognitive disabilities, looking at applied cognitive technologies as well as technologies overall and making them cognitively accessible from baked in stages. So I'm happy to have those of you on the line. I see we have quite a few folks and unfortunately I don't have California data is one of my states that will not give me data. So I will present the national data, but we hope to get some more of this data up before what will be our Coleman conference on October 3rd. So the title today is the State of States and Technology. For those of you who don't know us at the Coleman Institute, we have been around since 2001, focused on advancing and catalyzing new technologies to support people with cognitive disabilities and help them advance kind of those national goals that we have outlined by the ADA, which is, you know, full participation, economic self-sufficiency, self-determination. We have a number of those that we're looking to advance here. So technology is really advancing at an exponential rate, developing, you know, doubling every 2 years. Those of you who are in this realm know how fast we're moving, so I don't need to tell you, but it's really shaping how we culturally and socially live, as well as what is meaningful participation in our community. So we look at it from a number of different kind of perspectives. One of those perspectives is through our national data sets. And with the Coleman Institute, one of the sides we have is our national study on State of the States and Intellectual and Developmental Disabilities, which is a project, a longitudinal data project of national significance. There are 3 of us, also with the addition of national core indicators that track data on a national level longitudinally. And our colleagues are those at the University of Minnesota who track residential care, those at Boston, ICI Boston, who track employment, and then the Coleman Institute and the State of the States of the University of Colorado focuses really on the expenditures of services and supports across the states. So we've been tracking or attempting to track in a pilot fashion data on state expenditures for technology supports. And we started doing this in 2007. And we recognize that there is a gross under representation of the technology supports funded through the states, mainly because there are challenges with figuring out how to disaggregate that data, move that data across to different categories within waivers and other expenditure lines. So we've continued to do this, but usually every year we only get a handful of states that report on data and technology. And so you can see some of this. And these are, we just are completing up our 2017 data collection. And you can see the total expenditures for IDD services and supports is around 66.5 billion. Here in this graph, we've pulled out what is smart homes, which we started early on collecting, personal support technologies, and then we just started collecting on remote monitoring, really and truly in 2013-14. So this is a new data category in terms of variables for us. And you can see the current expenditures are well below what our national total expenditures for long-term care and supports. When we look at how many folks that the states report, so in the State of the States, we collect 2 main things, really and truly. money and participants. So how much states are spending and how many folks are involved in those supports and services. We have, when it comes to technology, again, underrepresentation of who we believe is actually using the technology, but we again broke it down by the 3 groups of smart homes, personal support technology, and remote monitoring. And the largest being the personal support, but we're also seeing the remote monitoring gaining some momentum, particularly in 16 and 17, with greater availability to do reimbursements from the states. And we'll talk a little bit about that, because what we have found from the state of the states is that we really want to do a deeper dive, certainly from a Coleman Institute side, to understand what is going on in terms of financial expenditures in the states. So we know that when it comes to getting technology, probably the primary barrier we hear to technology acquisition and use is funding. And so it has been one of the goals of the Coleman Institute to do some investigation on that and to try and figure out how can we, as an advocacy group, as well as researchers and policy supports, advance kind of these ideas of where funding can come from. And we know where some of them have come from, but we decided that in order to do a deeper dive into this data that we were getting from the state of the states, we were going to work with NASDs, which is the National Association of State Directors of Developmental Disability Services, to do a collaborative evaluation, so a survey based on from the state directors, which ended up in many situations the data collection was handed off to, may have been a Medicaid reimbursement individual, it may have been someone in charge of their waivers, but getting at this data at a more detailed level. And so we did this in collaboration with NASDs. We started collecting the data back in May, and as Destin referenced, we presented it at the NASDs, the preliminary results, at NASD's mid-year conference in June. And so we had some preliminary data at that point, only covered 23 states. And so today I have an update on this data, and some of the trends based on who has responded have changed a little bit. So it's always good to get the representation across the states. So the survey that we've put out, we've received from 43 states and the District of Columbia, the data. When we reported back in June, we had only had those 23 states. But we wanted to investigate what we know are creative funding mechanisms, as well as where states are looking to invest in the future in their technology. Again, from the perspective of the state DD directors and the service delivery systems there. So it's particular to people with intellectual and developmental disabilities. And you'll see we do have, sadly, sorry, California, we don't have you yet, but there's just a handful of states remaining that we are collecting that data on. And we'll be trying to update that in the last week here prior to our Coleman conference on October 3rd, when we hope to have a full picture. But just so you are aware, here are the things that we're finding. So we asked about 15 questions, and we were really looking to get, because the state directors are all the time bombarded with surveys. They're all the time bombarded from us on other longitudinal data sets to collect some information. So we tried to make this as simple as and easy as possible, with having a limited number of questions that both us and NASDs are really interested in. So NASDs, part of why we partnered with NASDs is because they continue to have state requests for what's going on in technology. How can their technical assistance supports provide some support to each of the states around technology development? Where are other states making their investments? How are they making the investments? And so this was of real interest to them as well. They're also working, and we will be working with CMS on reimbursement categories for the technology as we move into the future. But we're, so for the states, we have these series of questions. One of them was, what is your service and supports are your state currently funding? And by no surprise, certainly assistive technology and environmental accessibility adaptations or home adaptations are the number 1 and 2. Vehicle modifications, what we saw in the last survey when we did this in June, some of the lower categories have changed. certainly. So we're seeing more in the technology, kind of the personal emergency response systems. The evaluations actually creeped up to a higher level of category, with more states talking about the evaluations that they're providing. And electronic and remote monitoring of the 43 states had 21 states who were investing in it. And one of the things we're tracking or we're keeping an eye on is this idea of technology-based companion care. As we're seeing more and more digital virtual agents that are supporting people across the board, we're trying to keep an eye on that in terms of a new and emerging area for technology across the states. So this is a representation of what they are currently funding, what the states are.
Hey Shay, can you give us an example of the technology-based companion care? What is that?
Yeah, what that really is virtual companions. And so we have some states that are, we've seen this in the aging community where folks are having, instead of having a person physically there, they're providing companion care so that they'll check in with them, see how they're doing in the morning, have conversations with them, and really providing an external support. Now, some of this seems to be going through some of the remote monitoring, even though it's not defined as that. But this is a distinct category where it's just companion care. So it's just checking in and seeing how people are doing and maintaining friendships and relationships.
Okay, cool. Thank you.
Yeah, sure. Any other questions before I move forward? You can certainly.
I'm not seeing anything come through yet. Yeah, so please, if you guys are thinking of a question, just throw it in the chat box and we'll get it to Shay.
Sure, happy to. So one of the other things we've been watching for a long time here at the Coleman Institute is smart home technologies. And really those are sensors, microprocessors, data softwares embedded in the home for running autonomous smart products for multiple use. We're using the typical definition of smart home technology. So one of the things we wanted to know was, in terms of being able to track the funding lines, are the smart home technologies including in environmental accessibility adaptations? So we need to know this, whether people are defining it for funding reasons in this way. And 30% of the states that responded said yes, and 60% said no. So they are keeping them as separate categories generally in their funding streams. But we are seeing, smart home technologies is really, when we ask states, and I'll go through this at the end, is the #1 category that states are looking to invest in. So it's important to know, particularly this data, as to how they're funding it specifically. So application of remote and teleservices in the states. So we wanted to investigate with the states themselves how they're using teleservices. Is it for health-related reasons? Is it for therapeutic services? Is it, some are using it for individual support plan monitoring and eligibility determinations. We're seeing that eligibility determinations and assessments growing. At least here in Colorado, certainly there's new legislation to support assessments as valid virtually. So when previously the first visit had to be done in person, we're seeing now applications where those medical assessments can be done initially virtually. And some other states are moving in that direction. We have Project Echo, which is another teleservice and telemedicine, but it's interesting to keep an eye on that eligibility and determinations, because we're going to see in the rural areas that become very valuable. But the #1 is certainly therapeutic services. So this would be around speech and language supports. This could be evaluation in terms of what are already therapeutically identified support systems. And the health monitoring is really, can be sensor oriented too. So #1 is that telemedicine, therapeutic services. But we also noticed, and this was not identified in the last report we had done in June, but states reporting consumer satisfaction surveys are done due to teleservices, probably a lot for 5-year plans, for evaluation of person-centered plans. We're seeing that come up as a mechanism for identifying or using technology. Kind of what are so we do know that the purchasing of federal or of technologies is always the barrier that we hear, although, you know, folks that are earning approximately $25,000 per household are still purchasing iPhones and mobile devices. So it no longer has become such a increasing barrier. It's really priorities of where people are investing their money. So the number one utilization to purchase technology, applications, devices, or other solutions is the HCBS waiver. Sadly, you know, when we talk about threats to Medicaid, HCBS is on the chopping block as a optional service. So when we look at technology involvement and engagement, HCBS is currently the home and community-based services waiver is the number one resource. State plans are being utilized. Vocational rehabilitation is also being used. My guess is that is predominantly more for when we do our technology evaluations for individualized support technologies. General funds are the next. Other, which includes, according to our states, what are probably mill levy funds or local county board resources, family grants, waivers that are in the I, J, and K category, some university provided technologies. So we'll see that universities are providing some supports around technology, and some more family centered grants. So that's what falls into that other. The Money Follows the Person program has about 12 states. The ATAP programs, the Assistive Technology Act programs, and one of their charges is to look at alternative funding streams for technology. There's only 5 states that said they were utilizing that for purchasing, which they do have limited funds for actually purchasing. They really are a resource for identifying funding mechanisms. And then the Balancing Incentives program had 2 states responding. So that's about how they're purchasing technologies. You know, another challenge we see in kind of the use and ongoing supports of technology is having ongoing training. Those of you who, all of you are in this field know that without that ongoing training, we see the abandonment and non-use of technologies once folks gain them. We've seen, you know, even though this is a really durable consumer community, so once they find a piece of technology, they tend to stick with it. It also means that once there are changes to that technology, there needs to be support to do the upkeep and updates. So the question being is, does the state provide some funding for ongoing technology training, learning, upkeep, and updates? And, you know, we'd like to see this much, much higher, but only 50, about half of the states that responded are providing that support for ongoing training. And so we need to identify some other areas in which we can provide that training. So when we saw barriers from Ohio, we have folks on here from Ohio, 2 of the largest areas for barriers was lack of training and inability to solve problems on the technology when they occur. And that's where we get into the upkeep updates. We are seeing a lot of the companies providing specific disability related supports or customer services. Microsoft has their own disability support system for call-ins, and we're seeing more and more of the larger companies doing that as an activity to be able to support this network. But really there needs to be a holistic approach to the purchasing and maintaining of technologies. We really can't just do the initial purchase, the long-term maintenance of them as well. And so this was also a prompt we did some prompting. So if they are and they're about the same, you know, where we see the Assistive Technology Acts much lower, it still is that predominant HCBS waivers that are providing supports for technology use. Many said not applicable in terms of, and that's the large number of states that are not providing ongoing supports for training and assistance. State plans are still there, book rehab, other, and you'll see that general fund. But our concern is really around that 16 states that it's not applicable to them because they're really not providing that ongoing support.
Hey, Shea, we've got a question from someone asking about the Monies Follows the Person program. Can you kind of explain that?
Yeah, so it was, gosh, I'm not going to get the right year on this, when it was enacted, but it was a opportunity for folks to maintain their money and move out of residential care, and have the money follow them as they moved into alternative services and supports. And so they have distinct waivers to be able to do that, or they have distinct mechanisms through which the money moves with them. It maintains with the individual. And so it's not the same as what are considered self-directed or self-determination waivers, but it's a separate funding line where the money can go along with the person as they select some of their services and supports.
Good.
So,
great. Thank you.
I hope that answers the question. Sorry, I'm not going to get the year right when it was enacted.
That's all right. We don't expect you to have it all.
Top of my head, I should have that info. So this is where we're seeing this. So when NASDs and the Coleman Institute were investing some of this, we knew that a lot of the states were using pilot programs to fund, services and supports. And what were the actual hardware, software that they were identifying to support? Because we have had a lot of, family members who have said, we want tablets, we want mobile devices, but we can't fund them. What are mechanisms to do so? So we wanted to know what has been purchased in terms of hardware, software by the state specifically. And so they were able to, really disaggregate some of the areas in which they're making the investments. So tablets and computers were number one. Accessible appliances, which actually this is a category that shifted positions from our last report. Before it was really smart home solutions, and the accessible appliances have taken second recently. And I think that certainly is due to the appliances becoming more and more accessible globally. We have the smart fridges, we have the smart washing machines, that the washing machines become kind of the number one area where we see people making those investments. But smart homes solutions, and I'm always surprised that smartphones is actually lower on the group, but I think a lot of folks already have them without using public dollars or pilot funds for them. Digital health sensors, executive functioning and memory aids. These are usually softwares or apps or kind of different technologies that they can have. Those virtual assistants can come in there. Wayfinding and GPS technologies and services is number 9, as 9 states. Close with the shared transportation systems, we are seeing more provider agencies looking into shared transportation systems, such as the Lyft and Uber, and how to reimburse for that. And then last is internet and broadband. And I'll talk a little bit more about the internet and broadband. We're still seeing average 54% of adults with disabilities not having access to internet, with a comparative 81% of those without. So a significant difference in that technology gap access. And we do see that more and more of the younger generations are gaining access to their technology, and that they want to have access to that as a way of connecting socially and culturally with their environments, and even through schoolwork and employment. And so that prevalence in the technology divide is still pretty consistent over time, and has been over time. So moving into, so you can have an idea of what people are spending on. We have seen a large interest in the states around electronic documentation systems. We've even had one of the states reported that they're looking into technologies around abuse and neglect. for their services and supports. So when we look at electronic documentation systems, we have 23 states who are using it for billing specifically. Moving more into the individual service plans or care plans for tracking records and updating records amongst what may be kind of the team, the person-centered planning team. Records, so 20 states are using electronic documentation for that. And the updating is 18 states. And then staff management is about 5 states that are using kind of electronic documentation for staff management. Although, again, I will bring this up later in the presentation that there are, when you look at what states are looking to invest in, it's getting to be more and more around how can they support management of service delivery systems. So next is, how are they supported through residential rates? Now this is something NASD's and we combined. We were very interested in seeing how payments were made around particular technologies. So whether it was a direct payment of a service, an indirect payment through inclusion in residential or other